One of the major accomplishments of New Mexico lawmakers during this past legislative session was the creation of a framework for a health insurance exchange. Now, the exchange is required by law, certainly, specifically the Patient Protection and Affordable Care Act, known as others in some other circles as Obamacare. But did New Mexico move too late to avoid a one-size-fits-all solution? Here to offer opinions this week on The Line, former New Mexico House Republican Whip Dan Foley is here. Attorney and one-time chairman of the state Democratic Party, Jon Wertheim, is here. I'm going to ask everybody to join me in a round of applause for our new CEO of the Green Chamber of Commerce, Attorney Laura Sanchez. Congratulations. Very, very proud of you. And a new face. Very happy to welcome former state senator and current executive director of the Greater Albuquerque Medical Association, Diane Snyder. Diane, good to see you.
Thank you.
Please pardon me if I call you senator out of habit during this whole section.
Whatever you want.
That'll work out. Now, during that session, the governor and the legislature differed over a lot when it came to crafting the exchange, but they agreed on at least one thing. Don't let the feds run this plan. Diane, let me start with you. Why was that such a concern? Are we past that point now?
No, we're not past that point. I think it was critically important not only to the governor, but to the legislature and advocates and business experts, because we wanted it to work for New Mexico. And just taking one cookie cutter mold from the feds we did not believe anyone that this would be the best thing for New Mexico. Sure. So it took a while. It was really one of those bills that was worked the whole session. And finally, Senator Jerry Ortiz-Pino and Senator Benny Shendo and Representative Tom Taylor said, we're going to make this work. And they brought all the parties together and they negotiated and hammered it out. I mean, they were meeting almost 24/7 for the last 2 or 3 weeks of the session to do it. But the goal was that it would be a New Mexico version.
Interesting. Jon Wertheim, following that, what Senator just laid out for the scenario, we've got the people in place. We know the who. We've got our 13-member board set now. We have a date that we're going to miss, however, when this is supposed to be implemented, and we just found out in the last 10 days, we may not even get this going until 2015. So the difficulties here are certainly not over. So let's kind of chop at this one at a time. Your feeling about the makeup of the board as it stands now, do you feel all parties are represented at this point? You know,
I do. I think it's a very solid, diverse board. It's actually got a classmate of mine from law school who's Gabe Parra.
Oh, sure.
Who's a lawyer with Presbyterian Health Services. And so it's got some very Gabe is just a guy that I'm good friends with. That's why I mentioned his name. But there are very qualified people on the board. It was appointed by both the legislature and the governor. They're kind of split evenly on that board. And so it's a really diverse, knowledgeable group of people. I think we're in good shape in terms of that. I do think that we're a bit behind the 8 ball as far as the timing is concerned. These deadlines are very problematic now. The federal government has already had to kind of extend them, even though it's a statutory deadline.
Sure.
The Health and Human Services has passed regulations to try and give people enough time. But I do think that there was a failure of leadership on the governor's part. I mean, really, if she'd put this exchange on the session's agenda last year, that's really what she should have done. She kind of vacillated on whether New Mexico was going to go into the exchange or not. And that vacillation led to this year-long delay. And I think that that's going to be a problem, but hopefully the federal government will kind of work with New Mexico and let us go ahead with our kind of plan, because I think that Diane is making a good point that we want to have not just one-size-fits-all solution for New Mexico.
That's right. Interestingly, Dan Foley, you were mentioned in a Winthrop Quigley column in the Journal just a few days ago as one of those legislators back in your time who tried to get a health exchange going. So I'm curious what your thoughts are on two things, what Jon just mentioned. Pulling the trigger quickly enough or not, and now that we're at the point we're at now, getting this behemoth computer system up and running and getting all that going in a very short time frame. Can we make this work in your view?
Well, I think they can. I mean, even though we had the expert that did one that said, oh no, you're so many years out from getting it done. I think, you know, that was setting up one at a time when no one had a framework for it in Massachusetts. They were blazing new ground. Now there's, you know, people are catching on to this. I think it's a bigger question to make sure that the companies are coming along and are ready to offer the product.
Insurance carriers.
And doing the things that they need to do.
Yeah.
I disagree with Jon. I know that's a shock. I don't think the governor vacillated. I mean, I think that, you know, we weren't sure if we were going to be told we had to go, what we were going to do, how much money it was going to cost, if it was going to cost. And I think this October 1st deadline, you know, the feds have been telling us for years we can't give driver's licenses to illegal immigrants anymore. We're still doing that, you know. So, I mean, I don't think that October 1st is going to show up. I don't think the feds are going to be ready by October 1st. So I think that we're moving in the right direction. I think the board makeup, I agree with John and Diane and hopefully Laura, I think that the board has got a great makeup. You know, J.R. Dameron is a friend of mine that's been working on this since I was working on it. There's, you know, you talk about someone that understands this issue, has at his own cost traveled around the country getting educated on this issue. I think there's the right people are at the table, and they're going to do what's right for New Mexico, and I think it's imperative that we do not let this be a federal deal. The governor was right. It's a states' rights issue. She has talked about that from the beginning. She is trying to maintain the states' rights, but there was some consternation, you know, to John's discussion about the governor. If you remember at first, the legislature, there was some people in the legislature that wanted the feds to do this. So we had some conversations at first where the governor, you know, wasn't sure what kind of a fight we were going to have. So maybe had some of the leadership in the legislature step forward and said, no, it's a state deal, let's work together, we'd be further along. I think we'll hit the goals that need to be hit. I think we'll have a state exchange that's right for New Mexico in enough time.
Laura, what's going to happen in the interim, as these guys are laying it out, is if you're an individual without insurance, you are going to have to get picked up by the federal end of things. But a small business is a whole other thing altogether. And to me, this is where the rubber's going to hit the road on this health exchange. What's going to happen with small businesses? So again, let's start in general terms. From your point of view, are we moving in the right direction quickly enough, or is there a price to be paid for either New Mexicans looking for insurance down the road if they need it, if we don't just hurry up here and get something going?
Oh, I absolutely think there will be a price to be paid in terms of a lack of, basically a lack of insurance, of comprehensive insurance for folks. They're going to fall through the gap if we don't hurry. I think that we're pointed now in the right direction as a state, but I don't think that we've done things as quickly as we should have, perhaps. But all that being in the past, we now need to hurry and get things into place. And I think
the board just met for the first time last week.
They did. They just met for the first time, I believe, on Monday of this week.
Oh, that's
actually.
right, too.
And given that they just met, it's a 13-member board, and it doesn't have an executive director yet, so there's no person kind of leading it. A board, as we all know, can move things forward, but you really need somebody pushing the board and pulling the board along.
Doing all that
as
work
well.
when the board's not meeting.
Exactly.
You're
So
forgetting one thing. We're not starting from ground zero. We've had the Health Insurance Alliance in place for several years. And this board, I did attend, I didn't go on Monday, but I did go on Tuesday to see two things. How were the board members going to interact with each other, and were they going to rise above their individuals' philosophies, not advocate for them, but to work together and understand the immediacy of the issue. And I'm very thrilled to say that happened. But they also had Mr. Nunes, who is the CEO of the Health Insurance Alliance. And they are taking so much of the work that's already been done, even to a job description that's already been done by the Alliance. So they're really not starting from ground zero. And the expert who set up the one in Massachusetts is they had to start from ground zero. They had nothing. So we have the advantage. The only thing I see as a serious issue is the computer system and the technology. But son of a gun, we're right here in a technology-centered community.
That's right. Well, I'm glad you said that. Let me go back to Laura. I'm glad you just said that, Ms. Snyder, because we've spent, as reported, about $100 million over the past couple of years. That's no small amount of change to get this thing going. And it feels in my gut that we're not even close on this computer thing, the software. And we've had some very bad luck in the state trying to get big computer systems going, regrettably.
Yes, we do have a very old system in general.
Right. Please.
I wouldn't say that we lead as far as our state infrastructure. We're not as far behind as other states, so we don't want to be at the end of the list as we tend to be in a lot of areas. But I will say that there are two important deadlines coming up. You mentioned small businesses.
Right.
There is a deadline of May 30th for the state to inform the feds whether they're going to go with a small business exchange.
That's right.
And set that up. So there's a lot of work to be done this month. And in addition, there's a lot that has to be done to even, Dan mentioned that he didn't think the October 1st deadline even for the feds would be realistic. It may not be. Even at the federal level, there's a lot of information technology structure that has to be put into place in order for that to happen. The October 1st deadline, just so everybody knows, is actually a deadline where by that point, the state is supposed to be basically have everything set up, and every state is, in order for a person to come and who's uninsured, has to be able to go to, let's say, a computer portal of some sort and immediately get analyzed whether they qualify for Medicaid or whether they're able to get a different type of insurance in the private market. So that means linking together a lot of different types of systems that each have to be secure in their own way with personal
including
information.
Social Security,
Correct.
IRS. There's a lot
And that's
of
a lot of very
agencies
sensitive
involved.
data
That's
transfer.
right.
So the actual infrastructure is really important. But I will agree with what Dan said, you know, and what the senator said. It is important to recognize we're not starting where Massachusetts did. This issue of Massachusetts, the board recently heard from an expert that helped set up the Massachusetts system, which took something like 4 to 5 years back in the mid-2000s when there wasn't any system set up. And that was under Mitt Romney, and they did a great job of setting that up. But now we have, I think, we can learn from that. There's other systems that we can learn from. And there's also computer, I think, consultants who have the ability to put something like that
No
together.
lack of consultants.
Right.
Right, exactly. John, your thoughts here? Run a minute.
I mean, I think that there's a lot of the details of the rubber meeting the road, but I think we need to look at the policy. And just to remind everybody, is that what we're really looking at is a menu of options for income qualified people to be able to purchase insurance. And if we remember back to last year when the U.S. Supreme Court reviewed the Affordable Care Act, the so-called Obamacare, they upheld the so-called individual mandate. So now, you know, individuals who are presently uninsured, but let's say working, and this is where the small business exception comes in, you know, will be required to purchase health insurance. And so,
Or pay a fine.
or pay a fine, a tax is how the Supreme Court held it to be constitutional.
It's funny to hear that again.
But the end run of it is that it should be really good policy for New Mexico, because it means that we're going to have this expanded pool of people who are going to be paying in.
Does that not make the point that we need to move quicker, John?
Well, I think it
What
does.
you just said?
I think that that's where, you know, you can say, you know, did the governor vacillate or not in leadership? She maybe was sensibly waiting for the Supreme Court to come down on what was going to be upheld. Because it was a question about whether the individual
Timing
mandate.
was tough,
But
yeah.
at the end of the day, we do really need it. We have very low insurance rates here in the state. And the idea that we would have an expanded insurance coverage and more plans available for individuals and small businesses, I think all of that would be very positive for New Mexico.
You know, it's interesting to consider as we wrap this up, that what if we actually lead on this and say we are ready? We are one of the states, we have a need, we are ready on the required date, and like we put a man on the moon, we can get it done here in New Mexico. Would give up confidence for a lot of people here. We'll see how this all plays out. We're back in a moment with the future of a proposed horse slaughter facility down in southeastern New Mexico.